Hey, it's Deborah Atkinson. Look, a lot of times you want to exercise, but lower back pain, maybe it's knee issues for you, are a problem. They get in the way of you doing what you want to do. Well, the reason may actually not be your lower back or your knees. Your symptoms are not necessarily your problem. And in this 5 mobility move challenge, I challenge you to do this daily for 30 days and tell me what happens. When I'm releasing this live, it's October 1st. You tell me November 1st, did you do it every day and how do you feel? Not every exercise is appropriate for everybody, but there may be modifications of any of these that you can do. And if you need to leave one out, leave one out. 4 new mobility exercises every day is still going to do you some good. When you loosen and get range of motion back in your hips, often now we stop putting stress on the lower back and on the knees. Let's dive in here. Each of these poses is done either 3 times in the standing exercise you'll see first, 3 times each side, and then a minute for each stretch. So if it's on the right and the left, that's a minute each. Let's go. When you're done, don't forget to subscribe and ding the bell, and let me know how you do in the comments. For the standing lunge, just prepare yourself with legs apart. What you're going to do is get into a deep lunge, and notice I'm just dropping that back knee down to the floor 3 times and back up, but notice I'm not going up and down otherwise. Watch it again on this side. So I get low, flex and extend that knee, but the rest of me not going up and down. You want it to happen through movement at the knee and the hip, and that's really it. Then you're going to lie on the floor for the remainder of the exercises, shoes on or shoes off. Then number 4 stretch. The ankle crosses all the way over the other knee. I take my hands out on top here, but you could take them underneath the thigh for that threading the needle. Or, as I'm holding here on the lower leg, what you do want to make sure of is your little toe is pulled toward the outside of that knee, so you have a nice straight line at the ankle, no torque on that ankle. And although it may look tight, I'm pressing my knee out and away from my shoulders as far as possible. Not with my hands, but actively opening that knee joint from the hip. You're going to hold this pose for about a minute. Something to notice here is I am comfortable. The curve of my neck is comfortable with my head down on the floor. You may feel better slightly elevated. That's rolling up a towel on a small, thin pillow. You don't want to over prop. You want to maintain the curve in that cervical spine or your neck, but think about not straining. So if you feel like you're just really curved at the neck and pulling and putting torque on you, that's just a hint. You probably would be better to elevate your head 1/2 inch or so. The other side. Again, pressing out through the knee before you even go, just to loosen up slightly, threading the needle either under the thigh, or I could come over the top to the shin, or third option is just holding that lower leg and pulling it in. You want one hand close to the ankle, not pulling on the foot, and the other hand higher up on that shin, bringing the whole thing toward you. Try and press the knee away and look at opening up through the hip. So if you're feeling the work happen at your hip, your piriformis muscle, you're in the right place. For some of you, that may happen without adding any pull whatsoever. Just work on crossing the legs and pushing that knee out. That could be enough. So don't compare it to anybody else. It's just whether you do or you don't feel the stretch. Again, you're going to hold on this side for a minute. Try and take deep breaths here. Realize that your parasympathetic nervous system kicks in. The deeper you're breathing, the more relaxed those muscles are willing to be. This is crossing the legs. So as you cross one leg over the other, you also lift up and pull the hips up, dropping them now to the side. You want your shoulder blades both down. Your palms are facing up, so your chest is open, shoulders are open, no stress. and you're just allowing gravity to do all the work, pulling the legs over to the side, you may or may not feel the stretch across the lower back and through the hip joint. The determining factor is whether you need it. If you're already fairly mobile, you have good flexibility, you may not feel a huge stretch here. Most likely you are getting some, but don't let do I feel it, do I not feel it, be the judge of whether you're getting some benefit here. You're doing great spinal rotation by having the shoulder blades down and in place and allowing the hips to rotate to the opposite direction. So just enjoy it. Take a few deep breaths before we come up and out and go to the other side. If from here you feel a significant stretch, you want to make sure you come out of this very carefully. So just uncrossing that top leg, loosening them very easily before you prepare to come up and then to go to the other side. Kind of reposition, leg crosses over, lift through the hips, move it over to the side, and then drop in and allow the legs to roll. Again, shoulder blades, both should be down. So as my top leg, in this case, is my left leg, my left shoulder blade may be tempted or be pulled to come off the floor if I'm not so flexible. If that's true for you, you want to find a place where your shoulder blades are both down on the floor, and you may want to prop with, say, pillows underneath your legs so that your shoulder blades are able to stay down. You are getting the spinal rotation. And if we're pulling the shoulders up, we'll miss that. You won't be getting the rotation that you really want by anchoring one end and moving through the other. We'll hold here on this side also for about a minute. Deep breathing is going to help you relax, may help the shoulders let go, may help the hips or the lower back let go if you're feeling a deeper stretch there. Coming up, just reposition. This one, we go wider with the legs, and we call this legs falling to the side. So both just sweep to the side like windshield wipers. And then I took that bottom leg and I dropped the heel or the ankle on top of the other knee. Now, if you felt a significant stretch without bringing that one up, you certainly don't need to. Or if you put this ankle up on top of the knee and it feels too significant, feels like too great a stretch for you, simply put that foot back down. Where will you feel the stretch if you do have one? You may feel it across the front of your hip flexor, to the side of the hips, or in the lower back. Remember, there's no real right or wrong answer. When you go into a stretch, your body is going to feel it where you need it the most. There should be a big distinction for you between the comfort of going just beyond about 10%, where you feel the stretch, and discomfort. So in a stretch that's of the proper range for you to get benefit, there should be no discomfort, no grimacing. So if you're still there and haven't yet relaxed, I want you to back off of the stretch a little bit so that your body will release. Coming to the other side, you can see it a little bit better. Now I go right away to taking my foot to the top of that knee. The first time you come into this stretch, you may actually want to let yourself just stay with that for a minute and see how it feels. You also may have one side that feels significantly tighter than the other and feel as if you don't need that foot up on top of the other one. Pay attention to that. Clues about tightness on one side versus the other can lend themselves to giving you a motivation to stretch a little bit more on one side, warm up a little bit more thoroughly on one side, because you're slightly out of balance, and we want to prevent that from getting any worse. So again, here could be cross your hip, could be to the side of the hip or to your lower back where you feel the stretch. There's no right or wrong position. We do want to hold this for about a minute. both shoulder blades down, head and neck relaxed, just absorbed into the floor. When you're ready, you'll bring it up, and then we come up to reposition, and you'll want to be close to a wall here. Now, the alternative is do this near a couch, a sofa, or some kind of a stuffed or upholstered chair. And in that case, your foot does not have to go up the wall. So do you see what I'm doing here? So for those of you who are a little bit more mobility challenged in the foot and were really tight through that hip flexor, doing this so that your leg is coming up on a sofa and your foot is able to go straight the way it should. So you're more at a 90-degree angle at the angle may feel doable, whereas this right away is not always. And I have to tell you, it's not very comfortable while I'm in it and demonstrating. So what you do want to do is from the crown of your head down to that knee, you want to straight line as much as possible. So notice my back, it's not rounded over. I need to have that sternum lifted and coming forward. I'm leaning into it, allowing gravity to pull from my hips to bring that down and get a stretch and an opening at my hip flexor. And while I'm doing that, I'm feeling a huge opening across the hip flexor and down through that quadricep muscle. Now, deep breaths here, because this is really where you'll need them. This is probably where you're tightest, especially if you are someone who sits a lot or even stands statically. Probably establish some tension here. We hold for 1 minute here, and then we will hold another minute on this side, coming up into the second phase. Consider this position your warm-up. So allow yourself to get ready, because here we go. Coming up, lifting that. Now we're opening up that whole line from the shoulder down to the knee. Ideally, that's straight. You don't want those hips back behind you. You want to be leaning into it. And this one is still rather sticky. Now watch, I've brought my arms up, and I'll show you later. You could leave the arms down. Bringing them up really opens that entire front kinetic chain through the anterior part of the shoulder, the core, the hip flexor, all open up, and that's going to make the stretch at the hip even more significant. If you feel you're not quite ready for that, you can leave the arms down, but still take the hands back to the wall to open up. There it is. Do remember, you want that hip pressing forward here in this stretch. Now, equal time on the other side. So as you watch again, positioning, my knee happens to be about 6, not quite 8 inches away from the wall. The more you're flexible, the closer to the wall that knee will be. So if you need a little bit more room right now, you could be further away and or again over a couch or an upholstered chair instead. So it's not only a little softer, more comfortable for the foot to go still back in that 90-degree angle it's most comfortable in, but it's also going to cause a little less stress and strain at your hip if you're there. Top of my head, down to that knee, straight line, and I'm leaning into it. I'm just changing position of my hands periodically so that I'm really still leaning into it, paying attention. Hands can be on the outside of that foot or both inside, as you see here. And as I look down, it's important to be sure that you understand I'm not rounding the back. Lengthen forward with the top of the chest at all times. So again, we're here for a minute, and then we'll come up to the next spot. That front leg really shouldn't have to move at all here. So again, it gets a little sticky coming up. It's a greater intensity, more significant stretch occurring through that hip flexor. So I'm leaving my hands down for a bit now, just reaching back. Palms are face forward, and then if I decide I'm going to take that arm all the way up and even hand back to the wall behind me, even though my back is not against it, that's then causing me to open up more through that front kinetic chain and a bigger stretch. And imagine what we're doing all day, every day, many of us. are rounded over desks, desktops, keyboards. So this opening of all of that, shoulder, chest, hip, so very good to counter our posture day to day. And as we open up through the hip, we release tension that we may be trying to get mobility through the lower back, and that can also improve knees.